Hi, I'm Erin.
And I am Liliana. We're moms of children who had liver transplant.
The Transplant team has put together a series of videos for parents to know more about what to expect during the transplant time and to learn about how to care for their child after the transplant.
Throughout the videos, you will hear members of the transplant team describing each step of the process and giving you an idea of what to expect.
You will also see parents describing their personal experiences and sharing tips and strategies that have worked well for them.
We have included some photos of our children before, during, and after the transplant.
We hope this gives you an idea of how far they have come from the days before transplant.
We know this journey is not an easy one, and there is so much for parents and patients to learn in order to face the challenges and get to the point of a happy, healthy life for their child.
We have learned that working closely with the team, understanding and following the instructions, asking questions, and sharing our ideas for our child all contribute to the health of our child.
We hope these videos will be helpful to you in the liver transplant journey for your child. For Alexandra, I will say that I told her that we talked to her and she was 4 years old, so we just told her that she needed a liver transplant. We showed her pictures, and she knew that's how far we went with her. And we just told her that she was gonna need a new one. And when we got the phone call, we just told her that her new liver was coming. She looked forward, and that's all that she knew about it.
To prepare for getting the phone call, we made sure that our bags were ready so we could leave the house at any moment. We had this sort of be ready to take off kind of feeling around our house. Our phones were constantly charged, plugged in, sat beside our bedside tables. We got the call at 3:30 in the morning, and they told us it usually comes at night, and it did, just like we had expected. They said, go back to sleep, get some sleep, be at the hospital at 8 in the morning, and we'll take it from there. So I frantically cleaned my house until I realized that was a really bad thing to do, and went to bed and cuddled my daughter and snuggled with my husband, and we waited for the alarm to go off at 7.
Well, I brought some really silly things that were totally not necessary. I mean, I brought all these clothes for him and I brought all these toys for him. But I think, a change of clothes for us and a toothbrush and some formula for him probably would have been fine.
Hello, my name is Dr. Waldo Concepcion. I'm one of the pediatric transplant surgeons here at Lucille Packard Children's Hospital. It is important to us that you let us know if your child has had any colds or flu, nausea, vomiting, or exposure to chickenpox prior to coming to this admission. All this information, we will evaluate it and see if it's safe for your child to undergo transplantation.
Once you're called, you'll be asked to come to the hospital as soon as possible. The coordinator may tell you to have your child stop eating or drinking before you come to the hospital, or you will receive this instruction after you're admitted to the hospital. Usually, a child is not allowed to eat or drink 6 hours before the surgery. Once you arrive at Lucille Packard Children's Hospital, you will need to check in at admitting first, and from there you will be told to go to one of our inpatient units. When you arrive on the patient unit, the nurse will check your child's height and weight, obtain vital signs, and start an IV intravenous line through which your child will receive antibiotics and other medicines. We will draw blood and obtain a urine sample as well. The anesthesiologist and transplant surgeon or physician assistant will perform physical exams to assess your child's health. The surgeon will review the surgical procedure and ask you to sign the surgical and anesthesia consent forms. A social worker is available to provide help with lodging and meals, as well as to provide emotional support to you and your child through this challenging process. It is important to understand that sometimes patients and their families are called into the hospital for transplant, and the donor liver is then found to be unsuitable for the child. Although this is extremely disappointing, the surgeons want to make sure the organ is perfect for your child before transplanting it.
It was really the time between being listed and getting transplanted. We were a nervous wreck. waiting for the call and waiting for the surgery and not really knowing exactly what to expect. One of the nicest things that happened to us that really reframed it for us was the day of transplant. Everybody said, "Congratulations," and it was a happy day, and we hadn't looked at it that way. We were scared and worried about the surgery and about what our lives and her life would be like, but everybody was really enthusiastic and saying, you know, this is great and this is such a great day.
Hello, my name is Julianne Mendoza and I'm a pediatric anesthesiologist. The anesthesiologist gives medications during the surgery that put your child under general anesthesia. General anesthesia is a state of unconsciousness similar to sleep, in which your child is unaware and feelings of pain are blocked.
She doesn't remember anything. She was actually really happy when they gave the medicine, and then the nurse and the anesthesiologist, I think, came in to pick her up. She was just giving kisses to them and laughing. She was really happy. It helps a lot because it was kind of funny, but it helps me a lot to see her acting that way.
When it is time for the surgery to begin, the anesthesiologist will come to take your child to the operating room. Often, the anesthesiologist will give a medicine through the IV that will help your child to be calm and relaxed, so he may separate easily from you. As soon as they get into the operating room, the anesthesiologist will gently lay your child on the operating room table and put monitors on. The monitors will measure your child's oxygen level, heart rhythm, and blood pressure during the surgery. After these are in place, the anesthesiologist will put a mask over your child's nose and mouth to give him oxygen to breathe. Then general anesthetic medications will be given through the IV. The anesthesiologist will control your child's breathing by putting a breathing tube into your child's windpipe through his mouth. This is called intubation. All through the surgery, the anesthesiologist will give medications through the IV as well as anesthetic gas and oxygen through the breathing tube. These medications keep your child under anesthesia with no feelings of pain or memories or awareness of the experience. Once your child is completely under general anesthesia, the operating room team will start new IVs in several places on your child's body. These include his neck and chest, as well as groin, wrist, and legs and arms. These are needed to give medication and fluids and blood products. Once all lines and monitors are in place, the transplant surgeons will begin the transplant.
Welcome. My name is Carlos Esquivel, and I am the director of the liver transplant program. The surgeon will begin the operation by cleaning the skin with an antiseptic. An incision will be made across the abdomen, large enough to allow us to perform the transplant. The surgeon will remove the sick liver, then sew the healthy liver in place. When all the vessels are connected, blood will flow into the new liver, and it will become pink and feel soft and begins to work soon after. Next, the surgeon will connect the bile duct to allow bile to drain from the liver and may place a bile catheter to aid healing and keep the bile duct open for drainage. Throughout the operation, your child may receive blood products. At the end of the surgery, the incision will be closed using stitches on the inside or possible the staples on the outside. The entire procedure may take 4 to 8 hours, after which your child will be sent to the pediatric intensive care unit. During the operation, our main focus is the well-being of your child. We will be sure to have a contact number from you or give you a beeper prior to taking your child into the operating room. If possible, during the surgery, the operating room nurse may be able to call you and provide an update as to how your child is doing in the operating room. At the end of the surgery, the surgeon will meet you to let you know how the surgery went and how your child is doing. You will then be sent to the waiting area outside the PICU, where a member of the team will be able to find you. You will be brought to your child's bedside as soon as the PICU nurses have had a chance to settle your child into the room. And this is the beginning of your child's recovery.
Hello, my name is Melanie Merrill. I'm a physician assistant with the liver transplant program at Lucille Packard Children's Hospital. Your child's first stop after the operation will be the Pediatric Intensive Care Unit, or PICU. Your child will have several pieces of equipment attached to them, and it can be quite overwhelming the first time you see them. It helps to know that all of this technology is there to help your child during the recovery.
Right after her transplant, we sat by the elevator waiting for them to come, and the whole surgical team rolled her out of the elevator, and we followed her into the PICU, and they set her up. And we didn't really know what to expect. She had a lot of lines, and she was on a ventilator, and her incision was bigger than it had been from her previous surgery, but just glued shut and looked very innocent and pink and not angry. And there was a lot going on. I've never seen so much medical equipment surrounding one little person.
And so we'd like to go over some of the things that you may see attached to your child. Leads will be attached to a monitor, as well as a blood pressure cuff and pulse oximeter, which will help us monitor your child's heart rate, respiratory rate, blood pressure, and oxygen saturation. An endotracheal tube, which was placed in your child's trachea or windpipe during the operation, will be connected to a ventilator to help them breathe. Your child won't be able to talk, eat, or drink with the ET tube in place, but depending on their age, they will be able to communicate by using hand signals or writing on a pad. The doctors will remove the ET tube when your child no longer needs help breathing, typically in 1 to 3 days. 2 arterial lines, one in the wrist and one in the groin area, will be in place to monitor the blood pressure and provide blood samples. These will be removed before your child is transferred from the PICU to the surgical unit. A central venous line, which is a flexible catheter inserted into a large vein, will be in place to give IV fluids and medications, and if necessary, provide blood samples. Multiple intravenous lines, or IV lines, will provide pain relief, antibiotics, and other medications and fluids. A nasogastric, NG, or orogastric, OG tube, which passes through the nose or mouth and into the stomach, will help drain secretions from the stomach. The tube will stay in place until your child's bowel function returns, usually demonstrated by the child passing gas, having active sounds in their belly, or the passage of a bowel movement. This typically takes 2 to 5 days. If needed, we can deliver nutrition through this tube. 2 to 3 Jackson Pratt, or JP drains, will be placed in your child's abdomen to help remove extra drainage from the surgical site. These are usually in place for 5 days. A biocatheter drain will keep the bile ducts open for drainage and show how well the new liver is working. This will typically be in for approximately 3 months. A Foley catheter to drain urine from the bladder will also be present. We are usually able to remove this within 2 to 3 days. Your child will also be monitored closely with routine studies and laboratory tests. 2 include an abdominal ultrasound, which will monitor how well the blood is flowing in and out of the new liver, chest x-rays to assess the lungs while the endotracheal tube is in place, and blood tests, which will be done on a daily basis during the hospitalization, mainly to help us monitor how well the new liver is working. Once your child is medically stable and doesn't require frequent monitoring, they will be transferred from the PICU to the transplant unit, where nurses who have received special training in the care of transplant patients will continue to care for and assess in their recovery. The transplant team will continue to monitor your child's vital signs and laboratory studies each day and will be by your child's bedside each morning to discuss their progress. Your nurse coordinator and pharmacist will begin the discharge teaching you need to know in preparation for your journey out of the hospital. Your social worker will be available to you throughout the admission and after discharge to provide emotional support, connect you with resources in the community, and make sure you and your child are coping with everything that is happening. You too can play a role in helping your child's recovery go smoothly. You can help your child with the following. It is very important that your child walk. It helps build strength, stimulates the gastrointestinal system, and encourages bowel movements. We encourage you to take your child for walks around the room and in the hallway. You'll notice they become more active with each passing day.
They told me to do a lot of walking because that was gonna get me onto the 3rd floor sooner and home sooner. So I did a lot of pushing a wheelchair around the ICU and practicing sitting up on my own, and really just kind of anything they told me was gonna help me get out sooner. I was doing 110%.
Coughing and deep breathing exercises help prevent fluid buildup in the lungs. The nurse will help your child with these exercises and may teach him or her to use an incentive spirometer, which is a plastic container that helps them take deep breaths. For the younger children, we encourage bubble blowing, which is effective in expanding the lungs. Good nutrition is important after surgery. It provides the calories your child needs to heal and grow after the transplant. If they are unable to get adequate nutrition, your child may receive nutritional supplements through a nasal gastric tube. An important part of your child's physical and emotional recovery is relaxation and play. The Child Life Specialist will help your child find toys and games to play with during the recovery period.
It was wonderful. I mean, he got better so quickly. I was really expecting things to take longer. So when he came off the vent and his eyes started to open, that was wonderful. But then I expected him to just be laying in bed for a long time, but he wanted us to pick him up and hold him, and I was so worried about hurting him with the incision. But he just wanted to be held constantly, and he didn't seem to be in any discomfort at all.
I keep using the term overwhelming because when you see your baby and they have got all of these tubes coming out, right? And he wasn't awake yet when I saw him, but it was just seeing all of the tubes coming out. It was just, wow. I was like, wow. And that was the first thing that went to my mind. But when he finally, they did wake him up, and he finally opened his eyes. The first thing I said to him was, wow, you have the most beautiful eyes, because since the day he's been born, I never got the chance to see the full color of his eyes because they were always yellow.
This video ends with photos of my daughter in the PICU just hours after her transplant. The photos show the IV lines, drains, catheters, breathing tube, and her incision, and the equipment around her bed in the ICU. I wanted to share these photos because it helped me to know ahead of time what to expect when I first saw her after the surgery. To me, it was amazing to remember what she looked like just after the transplant, and then to see her now. If it is helpful for you, please continue watching. If the photos will make you uncomfortable, please stop the video now. As always, if you have any questions or you want more information, I encourage you to talk to anyone on the transplant team.